This vitally important Veterans Health Bill is being held up, as you know, by a senator. Each day that this measure is delayed, of course, means that vital benefits for our veterans are also delayed. This, without question, is a bipartisan bill for the committee, fully approved in regular order and in full support by our ranking member, Senator Burr. This bill is also supported by many veterans organizations. This bill is to provide caregiver assistance to the most seriously wounded veterans. Under this bill, VA would provide caregivers with counseling, support, and a living stipend. The measure also provides health care to the family caregivers of injured veterans. By blocking S 1963, this senator is also blocking benefits, specifically for women. Women veterans, for VA's healthcare personnel, and for veterans living in remote and rural areas. The senator, who has been blocking parts of this bill since the summer, argues that this bill is too expensive. I believe that when we vote to send troops to war, we have an obligation to take care of them, and this is what we're trying to do. The senator blocking this legislation wants to propose an amendment. Let's agree to debate the legislation. We are preparing to observe Veterans Day, and our country is preparing to do that also. So let us allow our deeds to speak for us.
Bottom line is we passed this bill out of committee, and correct me if I'm wrong, Mr. Chairman, right around Memorial Day. I think it was before Memorial Day. Here we are some 5-6 months later, right before Veterans Day, and this bill still hasn't passed the Senate floor because there's a hold on it. And it's time to remove the hold. I appreciate the chairman going to the floor to ask unanimous consent to be able to move this bill because I think it's the right thing to do. And as we all know, as bills go through the Senate, there are plenty of reasons to say, no, I'm not going to support that bill. This bill's not one of those. This is one of those bills that makes sense for our veterans, makes sense for our veterans in rural America, and we need to live up to the obligations and the promises that we make our veterans when they sign up and go to protect this country.
Unfortunately, as said by the other two speakers, as we move toward Veterans Day, a member of the Senate has placed a hold on this bill, denying better services for our veterans because he is concerned about the cost. There is truly no price too high to take care of our veterans. The nation's obligations to care for veterans cannot be conditioned on whether or not it can be afforded.